Hey, welcome back to the channel. Thanks for joining. So a different kind of a video today. We're not going to be talking about cars or any of the normal subjects that I review. This time we're going to be talking about an upcoming surgery that I have. And I'm not making this video for me. I'm making it for others that may be experiencing or about to experience the same thing. I found it very helpful to watch videos of others so that I knew what to expect. So what it is I've got spinal stenosis. And spinal stenosis isn't supposedly not due to a back injury or anything like that. Structurally, my back is in great shape. It always has been. I've never had back problems. But stenosis is the narrowing of the spinal canal so that it eventually squeezes in on the spinal cord and then causes problems. So I have been diagnosed with this, and I'll kind of go over the timeline. And I'm going to have to have laminectomy surgery, laminectomy on 3 levels, L2 through L5, and then a fusion. So that's what's happening. As I make this video, it's happening in about 2.5 weeks. That's when it's scheduled for. And just to let you know a little bit about myself, I'm past my 50s. Hard to believe, I know, but I'm past my 50s. A lot of the videos that I've seen are people in their 30s. So again, you're going to have different issues depending on the age. So I'm past my 50s. I've always stayed in shape. I have been, weight training since I was 18 years old, but not heavy weight training. Let me take that back. Heavy training, yes, but not heavy squats or heavy leg exercises. So I've never been a heavy squatter. So for those who might think, well, he messed up his back because of heavy squatting, never done heavy squatting. You'd probably be able to tell by my relatively skinny legs compared to some of the other people that really do heavy squats. So always kept in shape. My wife and I walk a lot. At least we did. Lots of hiking, lots of walking. And I believe that walking is really a key to longevity and keeping healthy as you move forward. I'm reminded of one of the old Coney Island strongmen from the 1920s, Joe Rolino. He walked every day. He lived in New York City. He walked every day like 5 miles, even through his 104th birthday. But unfortunately, at 104, he was crossing the street and he was hit by a minivan. Anyway, he was in fantastic shape his whole life, and I think walking kept him that way in his later years. In any event, I, again, had never had any back problems. I still don't structurally. As I sit here, I have zero pain. I'm fine. But what happens now, starting in about 2017, so about 6 years ago, I had moved to the Washington, D.C. area, and I was in the gym, and I was doing some overhead presses. And all of a sudden, I felt this weird feeling in kind of the lower back, into the legs, into the buttocks and leg area. And it was just kind of a weird feeling I never felt before. It's not like a back pain per se. It was different, but it was in that area. So I thought it was kind of weird. It started to get a little worse. And then I remember specifically, I work in Washington, D.C. We were going out after work, a bunch of people from the office. It was a little get together at a restaurant. And I was walking from the metro station, and all of a sudden, my right leg started feeling a little weird. My right foot started to tingle and get numb. And then that right foot, or rather the whole right leg, started to kind of disconnect. And I was almost laughing because it was so weird. And it's like, what's going on? And then it's kind of started in the left leg, starting in the right first, then the left. So I immediately had to stop. I had to kind of squat down, bend over to get relief, which it gave me. And then I walked the rest of the way. But it progressively has been getting worse since then. I can't walk the way I used to at all. I mean, again, we used to walk miles. There's a beautiful lake near us, and we'd take walks all the way around the lake, about 3.5 miles or so. And again, can't do that now. It got to the point where, I can barely walk 50 yards outside, and I have to stop. I mean, I'm in pain. My right foot's starting to get numb and tingle, and the leg starts to disconnect. So I have to stop. I even bought this collapsible round collapsible chair from Amazon. You open it up and then you carry it over your shoulder. It's plastic, it's lightweight. So as I'm walking, I can stop, I can expand it, put it on the ground and sit down, and that gives me relief. But in any event, I wasn't able to walk far at all. And it got to the point where even when I'm at the office, walking up to the office from my car was painful. And, you know, even getting up to walk to the bathroom during the day is painful. But again, when I go back to my desk or stop what I'm doing, if I'm walking and just sit down, the pain goes away completely. Like, again, right now I feel totally normal, but I'm not. I've had 8 or 9 spinal shots, epidurals, to relieve the pain and relieve really the inflammation. And when I was getting those at first, it kind of made it so that at first I could walk, and, you know, for almost normal distances. But then gradually, again, over the years, the shot was less effective, and you basically now, you're not supposed to get them more than every 3 months. After 2 months, the pain starts to come back, and I'm right back where I was. So I've gone to I've gone to a couple surgeons. They've said the same thing, that based on my condition, I'm going to probably need surgery. I've tried everything else. You know, physical therapy does nothing. That's not going to open up the spinal canal and make it any easier. And so what I did is I went to a pain doctor, and I did some research, and there's this minimally invasive procedure called the mild, M-I-L-D, mild procedure. A company called Vertos are the ones that invented this, and they also sell these little tubes. And what it does is you have the procedure where they stick a tube on the left and the right side of the spine. The tube goes in, and then this tool comes out of the tube, and it scrapes away, I think, at ligaments mainly. So if the ligaments are kind of expanding and encroaching on the spinal cord, they tried to scrape that away. And apparently it's very effective for some people, depending on what is the nature and how bad the condition. So it unfortunately did nothing for me. I had it back in January of this year, so about 10 months ago, and again, it did absolutely nothing. The good thing about it is it doesn't mess up your spinal area. Just like when you get some surgeries, they have to go in and they have to do revision surgery to kind of fix what was done in the previous surgery. This isn't a surgery. So no revision surgery is necessary because they didn't change anything. They didn't remove bone. They basically just kind of scraped away at the ligaments. And again, unfortunately, it didn't work. But I was up walking that day, and there was basically no recovery period. It was fine. But again, it doesn't matter if there was a recovery period or not. It didn't work. So again, I've gone to my surgeon now, the one that I found that is supposedly fantastic. So I'm putting my confidence in this guy. And basically, it says the assessment was that the patient has significant stenosis from L2 to L5, and there is severe central canal stenosis at area 3 to 4. And there's moderate to severe stenosis, L2 to 3 and 4 to 5. So I have difficulty walking, when the shot wears off, the epidural, I have difficulty walking far at all. I can't even stand up long enough to brush my teeth or to even take a shower. I've got to sit down. Luckily, the shower, it's a big shower, and there's a seat in the shower, but I can't even make it through that. So definitely, even though, again, no pain as I sit here, it's something that I need to do for quality of life, and so that as I get older, I'm still able to walk and keep condition and keep in shape. So it says also that indicated surgery L2 to L5 laminectomy with posterior lateral instrumentation fusion. I guess that's where they put the screws in and then put the rods in. And then it says decompression and fusion necessary due to the amount of facet joint that would need to be removed, which will be more than 50%. So that's what's going on. I'm not sure the recovery period. Again, I'm doing this pre-surgery. So as a heads up, I will be doing more of these, hopefully, once the surgery happens, and then I'll be able to sort of document the recovery and what I'm able to do. You know, I hope I don't totally shrink to nothing, since I won't be able to go to the gym for a while. I bought one of these things. I wish I had it with me. One of these things in Amazon. It's like a spring with handles, and you're going to like that. So at least, you know, I think not too long after the surgery and the recovery starts, it really doesn't do anything, I don't think, to move my spine. So we'll see. I mean, as soon as I try it, I'm going to know immediately. There are tons of other issues. I don't know what kind of equipment I'm going to need post-surgery. You know, I've been told I'm going to need a walker, especially at the beginning. Maybe not for too long, but especially at the beginning, maybe a cane. You know, I'm told you may need to raise the toilet seat up to make it easier to get up and down from the toilet seat. And, you know, there are probably other things that I'm going to do. Oh, they said a picker-upper. One of those claw things, you squeeze it and it's got a claw on this end. Said because you can't twist, bend, or there was a third thing too. So, you know, if something drops on the floor, you're not going to be able to really bend down and pick it up. You've got to use this claw thing. So in any event, this is happening soon. I wanted to do this video to let everybody know, to kind of keep track of what's going on. Again, this is for especially people that are going to go through this. Hopefully this will be helpful. If you haven't already done so, and some of you may be new because you haven't been watching my old videos, but please subscribe to my channel, hit the like button, and also the notification bell. The subscribing helps tremendously, because the more viewers I have, the more I'll be able to keep these videos going. So thanks again. We'll see you next time soon. Take care.